The endocrine system is a body system that is based around the control of ductless glands that secrete hormones and circulate the body. These hormones are often sent throughout the body via the bloodstream, and as they arrive to the specific cells, they do many different things. The endocrine system regulates mood, growth, and development, along with tissue function, metabolism, and sending messages. The many functions the endocrine system carries out regulates when hormones are released to keep the body in balance. Some common endocrine glands include pituitary, thyroid, and adrenal glands. Salivary glands and sweat glands are not part of the endocrine system, which is a common misconception. Diabetes is a common disease associated with the endocrine system that causes high blood sugar within people either because the body does not produce enough insulin or the body has problems using the insulin that it produces. Insulin is a hormone secreted by the pancreas that regulates the amount of glucose within the blood of a person, and without it, the body cannot function correctly. Diabetes is organized into 3 different categories, although 2 are more commonly known. Type 1 diabetes and type 2 diabetes are the 2 more common forms of this disease. Type 1 diabetes occurs before birth and is caused due to the body's failure to produce insulin. Type 2 diabetes occurs beyond birth and generally is more common in adults who follow bad diets and have poor physical exercise. With type 2 diabetes, the body rejects the insulin that is created by the pancreas, causing many health issues. The more uncommon type of diabetes, gestational diabetes, is due to a pregnant woman getting high blood pressure, which eventually leads to type 2 diabetes. Type 1 and type 2 diabetes both have similar symptoms, however are not completely the same. Type 1 diabetes has many symptoms that may seem quite common, which is one reason why so many people don't know they have it right away. These symptoms include extreme fatigue, frequent urination, continual thirst, severe hunger urges, and unexplainable weight loss. These symptoms may seem quite unrelated to each other, however, they are all caused from the lack of insulin. Insulin can be injected by people with type 1 diabetes, which essentially brings the body back to normal in terms of the processing of glucose. However, if there is a lack of insulin, too little food, or low blood sugar with type 1 diabetes patient, they may have a risk of reaching a dangerous condition known as ketoacidosis, which occurs when the body cannot find the glucose it needs to function. Ketoacidosis is followed by a series of symptoms such as chronic fatigue, dry skin, vomiting, labored breathing, difficulty focusing, and also can cause much muscle fatigue. This can be fatal if not addressed with medical attention. Type 1 diabetes is generally contracted through heredity, however, it can be contracted later in life. Type 2 diabetes follows similar symptoms to type 1 diabetes. Like type 1, symptoms such as extreme thirst, weight loss, and frequent urination are common. However, type 2 diabetes often includes infections that heal slowly, blurred vision, and even increased chance of yeast infections. Type 2 diabetes is contracted through heredity, poor diet, obesity, and lack of exercise, or all of these combined. Both type 1 and type 2 diabetic patients use a glucose meter. This is a device that takes a sample of blood from one's fingertip and tests it for glucose concentration. By having this device, type 1 diabetic patients can determine when they need to inject insulin, and type 2 diabetic patients know when they need to eat food in order to keep their glucose level at a steady rate.
Insulin is the hormone that regulates the intake of glucose by cells. The insulin is necessary to feed the liver, muscles, and fat tissue cells, which store sugars as glycogen. Glycogen functions as a long-term energy storage in animals and can provide energy for the body if it runs out of food. Both type 1 and type 2 diabetes impact one's body systems in many different ways. First, it lowers glucose levels, which throws off homeostasis because homeostasis is responsible for regulating glucose level within the bloodstream so that the cells around the body can get the nutrients they need. Second, it causes high blood sugar, which can cause dehydration of the body and decreases glucose absorption. Homeostasis is thrown off by high blood sugar because the body needs to be able to allow enough glucose to get into cells, along with keeping the cells hydrated with water. Another example of how diabetes disrupts homeostasis within type 2 diabetes is the insulin created by the pancreas is not recognized. Insulin is responsible for regulating carbs and lipids within metabolism. Therefore, the balance of the body is thrown off by not getting sufficient carbs and lipids where it is needed. The overall effects of all types of diabetes on the endocrine system is that it impacts our cells' ability to receive energy.
The effects of diabetes doesn't only affect the endocrine system, it also impacts the nervous and immune system as well. The nervous system is mainly affected because the insulin is the primary hormone that regulates the amount of glucose that passes into the nerve cells. This lack of glucose within the nerve cells causes numbness and sensation, increased pain sensation, decreased muscle control and function, and difficulty with organ control such as bladder and bowel. These systems of the nervous system are all affected because of the lack of insulin that regulates glucose, which is essentially caused from all types of diabetes. Diabetes also has an effect on the immune system in that it makes the patient vulnerable to risk of contracting other deadly infections or diseases. As time passes, the immune system can begin to attack its own organs in the body, such as beta cells in the pancreas, causing damage to the pancreas and also discharging less insulin or even none. This is one reason why type 1 diabetes patients need to take injections of insulin, because their body has stopped producing it. Within the U.S. alone, as of 2007, 23.6 million people have some type of diabetes. The amount of medical care these people need, such as insulin and glucose meters, resulting in a U.S. cost of over $12 billion. The overall cost of the world is a shocking $3.4 trillion.
The way people live can greatly affect their diabetes. One example is that if one is lazy and does not receive a lot of physical exercise, they can develop type 2 diabetes and potentially even make it worse if they already have it. With type 1 diabetes, bad diets can greatly affect their diabetes because they need certain sugars and foods at specific times to regulate their glucose level and to ensure that the insulin intakes will work to full effect.